And next we have a proclamation to designate Monday, October 24th, 2022 as Polio Awareness Day. And this was requested by Supervisor Gross, co-sponsored by myself and Supervisor Palchik. And our speaker today is Pat Borowski, Chair of District 7610 of the Rotary Foundation, who already knows what to do and is down here in front of us. And at this time, I will turn to Supervisor Gross.
Thank you, Mr. Chairman. And we have done this in the past. A lot of people think that polio has been eradicated, but it hasn't. And so it is important that we continue our efforts to make sure that people are immunized. Whereas the effects of polio have long been recognized, including in Egyptian paintings and carvings, showing people with withered limbs and young children walking with canes. And whereas in 1789, English physician Michael Underwood referred to polio as, quote, a debility of the lower extremities, unquote, that eventually became known as infantile paralysis because it affected so many children. And whereas epidemics of polio broke out in Europe, North America, Australia, and New Zealand during the first half of the 20th century, and in 1952 in the United States, the polio epidemic was the worst outbreak in the nation's history. And whereas World Polio Day, October 24th, was established by Rotary International excuse me, to commemorate the birth of Jonas Salk, leader of the first team to develop an effective vaccine against polio. And whereas since 1988, cases of polio have dropped by 99.9%, and the world stands on the threshold of eradicating the disease, now therefore be it resolved that the Fairfax County Board of Supervisors, on behalf of all residents of Fairfax County, does hereby proclaim Monday, October 24th, 2022 as Polio Awareness Day in Fairfax County, and urges all residents to support Rotary International and its partners in the work to immunize children of the world against polio. So moved.
I'm happy to second that along with Supervisor Palchik and Supervisor Lusk. Discussion on the motion, Supervisor Gross.
Yes, Mr. Chairman, I am fully aware that October 24th was yesterday, but because of timing issues with board meetings, we decided this was really very appropriate anyway, because it does indicate that the board and that the Fairfax County has an interest in eradicating polio and in bringing that information to the community. You know, as we talk about vaccinations for all sorts of things these days, it's almost automatic that you get your polio vaccine when you're a little kid. Looking at this proclamation, in 1952, the polio epidemic was the worst outbreak in the nation's history. I remember that. I was a little girl. There were children in what they called iron lungs in hospitals all over the place. It was a very big deal. I was learning to read at the time, but I do remember the news reports and so forth about this polio epidemic, and that was prior to any kind of vaccine that we had. It was a few years later when we all got the sugar cube vaccine, but I suspect that most of us know people who have suffered the effects of polio. The most famous, of course, was probably Franklin Roosevelt, but my neighbor who lived across the street from me for decades had contracted polio when she was a little girl, and that would have been in the 1920s. She spent 8 years in the hospital because there was no other place for her to be able to be cared for, and she was just a teenager at the time. She lived to be 98, but she suffered her entire life with the debilities of polio. She never learned to drive. She was never able really to walk on her own without an assistive device. And I always think about that and how just devastating polio can be. It doesn't have to be anymore, and that's why we're doing this proclamation. So I appreciate the opportunity to bring this forward. Thank you.
Thank you, Supervisor Gross. The power of vaccines, and I think, as we sit here today, I know I am concerned about the state of discourse in our country with regard to vaccines and science and data, and how vaccines and science can save lives. And if anything, we're seeing, I think, an unfortunate backsliding in some statistical areas when it comes to doing things not only to protect ourselves and protect each other. And yesterday we all got noticed about the concerns at Inova Hospital, with the number of patients in there with respiratory issues related to flu and COVID, and things that vaccines exist for. They may not be 100%, but we're seeing firsthand what can happen to our healthcare network in our community when people don't take responsible action and get vaccinated. And certainly polio should stand, as Supervisor Gross mentioned, and as an example of a very successful vaccine rollout, and a lot of people who went through a lot of pain as a result of not having a vaccine in a timely fashion. And I think it's something that, as we sit here today, we can take notice of, not only as it relates to polio, but so many other health pandemics and challenges that our community face right now as we sit here today. And so I'm happy to support this and to raise awareness, not only for polio awareness, but frankly the power of vaccines. Other discussion, Supervisor Palchik.
Thank you, Mr. Chairman, and thank you for your work today. Prior to my local work, I was doing international development, and the campaigns to stop TB, malaria, HIV/AIDS, preventable diseases, polio, all of which we have vaccines, and require simply the political will, the organization, and the support to ensure that we eradicate them. I know I share the concern, deeply the worry that the chairman shared, seeing that we have that access here, seeing what it is like when those vaccines are not accessible, and the impact it can have on so many lives, whether they're fatal diseases or like polio, such a debilitating disease. And so I really appreciate the work you're doing. I'm distraught to see at today's age for other vaccines, but even for polio, seeing that they are not being used, and the impact it can have on kids and an entire community. So thank you for what you do. It's unfortunate that this still has to be raised as such an issue, and I'm very fortunate, even though we're a day late to celebrate it, that we are here today, and that we are here, and you're here every single year, ensuring that we continue to raise awareness and advocacy for
Thank
this.
you.
Thank you.
Thank you, Supervisor Palchik. And with that, if there's no other discussion, all those in favor of the motion, please say aye.
Aye.
Any opposed? Any abstentions? That motion carries. Pat, welcome. The floor is yours.
Welcome. Thank you very much. We really appreciate this opportunity. And first and foremost, on behalf of our current district governor, Sheila Brennan from the Rotary Club of Vienna, our apologies. We had a longstanding district event that unfortunately conflicts with this date. But it is, and on behalf of all of our members, particularly in Fairfax County, thank you, because we know this is a bipartisan commitment. And I think Fairfax County needs to be real proud of that, as well as being emblematic and an example of what a successful bipartisan effort for vaccines is all about. My role here today, as always, is to kind of give you an update. There was no effort to eradicate polio until 1979, when Rotarian leaders, which included 5 from the United States, decided that it was crazy we weren't sharing the vaccine. And so they actually rented planes, went into the Salk Institute, got the virus because there was an active outbreak in the Philippines. And this was all supported exclusively by Rotarians and their efforts. And they vaccinated the entire country. And that was to demonstrate to the World Health Organization and UNICEF that it could be done and that we would support it. Today, the active polio countries are Pakistan and Afghanistan. And if we can please just finish the effort. Those of us, and you may also know that I speak to you as a witness to polio. I am the daughter of a polio survivor. Polio, for all of the efforts there is no cure to polio. And additionally, there is nothing, once you contract this paralytic virus, that anyone can do for you except make you comfortable as you go through this. So unlike flu, if you have those symptoms and you can get it, or even with COVID, you have an additional medication. There is nothing that works for polio. So the only issue for polio is vaccination and eradication, and we're very close. As you may also know, polio has risen its head again in the United States, which is an indication that infection is a plane ride away. The CDC has advised that the outbreak in New York is the same genus virus that was found in Jerusalem, Israel, and also in London in the UK. The derivative of that was a live virus vaccination program out of Pakistan, because all of the vaccination have their own derivative identification, so we can say where that came from. Someone who has received a live virus vaccination could have contracted polio beforehand and be asymptomatic, as we have learned with COVID. But they can shed that polio virus for over a year in their urination. So, and as you know, New York has two cases of polio from directly this derivative, and has found polio in their water. As a result of that, the World Health Organization has put the United States back on the list of active polio cases. Further, because the world was a bit surprised at the strength of the anti-vaccination movement vis-a-vis COVID, they have actually created a new organization in the United States called the vaccinateyourfamily.org, and it is actually broad-based to re-educate people in the United States for all sorts of vaccines, and particularly for polio. We that have witnessed this, and of course our thanks to Representative Penny Gross, who's from my district, so I really appreciate that. But I know each of you are involved in this as well. We have formed a worldwide coalition that includes the World Health Organization, UNICEF, Gavi, the Vaccine Alliance Results, the UN Foundation, Global Citizens, and the Gates Foundation. So we do not, of course, our partnerships didn't start to 84, so we had to fund it from 79 through 84. But we have committed as Rotary International $150 million to the next 3-year effort. And with the Gates Foundation, we hope that will be $450 million over a 3-year period. And we, all of us, for our countries, we go ahead and make sure that our countries are participating, and you should be very proud that the United States leads that government coalition in doing this. Those of us that have witnessed this paralytic disease, people survive polio, they do not recover. When they survive, they hope it is with the least amount of impairment. They live for the rest of their lives in pain. And about age 45 through 55, they all, whether they exhibited paralytic conditions or not, begin to be affected by the secondary syndrome of polio, which is the wasting of the nerves, the wasting of the muscles come back. Those of us that have seen that have a special obligation to be the awareness agents, if you will, to make people understand the only way is to eradicate polio. We did it in smallpox. We can do it in this. So we thank you very much, and we will continue this fight. Thank you.
Thank you very much, Pat. Excellent comments. And with that, I think we're ready for a photo. Supervisor Gross and I will come down and join you.
Thank you.